Speakers today will be Mr. Tracy Doty, President and Chief Operating Officer, Huntsville Hospital, Dr. Wes Stubblefield, District Medical Officer, Alabama Department of Public Health, and Dr. Sherry Squires, Emergency Room Director of Huntsville Hospital. Before we go to our guest speakers, I'd like to go over the current numbers. Since the pandemic began in the state of Alabama, there has been 1,229,300 confirmed cases of COVID-19. Again, since the beginning of the pandemic, in Madison County, there's been 83,501 confirmed cases. Current positivity rate for Madison County is 36.2%, and the current 7-day average of daily increases in Madison County is 623.57. At this point, we'll go to our first speaker, Mr. Tracy Doty, Huntsville Hospital.
Thank you, sir. As always, we'd like to start out by thanking city officials and the local EMA for hosting these briefings. And as always, thanks to our frontline workers who are doing the brunt of the work and on the tip of the spear taking care of patients in North Alabama. Currently in Huntsville Hospital, that's Madison Hospital, the main campus downtown, and in Women's and Children's, we have 267 positive COVID patients. 42 of those are in the ICU and 30 of those on the ventilator. If you look at our peak, this was pre-vaccine, December of last year, the peak was 278, and now we sit at 267. Go back about a month ago, there were 100 hospitalized patients in Madison County, so we've seen a rise over the last 4 weeks at a pretty good clip. Crestwood adds another 28 positive inpatients to that total. If you look at our system, system-wide, we have 465 patients hospitalized with COVID-19 in North Alabama and the Huntsville Hospital family of hospitals. If you look at Madison County only, the age distribution is about 67 is the average age. It's a pretty even spread, bell curve throughout the ages. The bulk of those are between 50 and 80 years of age. And we have 13 positive pediatric patients, and one of those patients in the ICU on the ventilator. Gender, it's been that way for a while. It's about a 50-50 split, males to female. And if you look at our vaccination rate, about 70% of the patients in Madison County are unvaccinated in the hospital, and 80% are not boosted in the hospital. So it lets you know vaccines and boosters are very important. We've had 2 deaths in our system in Madison County in the last 24 hours and 10 since Friday of last week. We all know the dominant strain is Omicron that's out there. Depending on which reports you read, it's between 95 and 99% of the COVID-19 new cases out there, and we do know it spreads much more easily. If you look at our positivity rates, which is something we track pretty closely, we're at 37% for the last 7 days. Our peak was last week at about 45%. If you go back to mid-December, it was about 5%. So we've seen a huge rise in our positivity rate as Omicron came online. We all know that vaccines are still a great defense against the disease and preventing serious illness. And so we're encouraging everybody to get vaccinated and boosted. We're still at John Hunt Park giving vaccines out. Local health department, most large box retail stores, Walmarts, many places you can get a vaccine and a booster. So we're encouraging everybody to get those. There's not a shortage of vaccines out there. On calls we're on this week, we're hearing that the FDA may approve vaccines for below the age of 5, so 6 months and up to age 5. And we plan to do those at John Hunt Park once they allow us to do so, and we're hearing that it may be as early as late this month that we can do that. But they asked the FDA for approval yesterday, and they'll go through their process and maybe have some approval by the end of this month. We've continued and will continue to go out to the community and give out vaccines in underserved areas and churches and the homeless shelters, and we'll do that as long as we're needed to do so. Our fever and flu clinic on 120 Governor's Drive remains busy. They're averaging about 70 patients a day, and a month ago they were seeing about 150 a day. So we've seen a drop there, which is a good sign as well. We get questions about monoclonal therapy quite a bit. So we get about 12 doses from the state a week, and we reserve those doses for people at high risk. These are pregnant moms who have other issues, cancer patients, and people recently had an organ donation. So we get about 12 doses a week, and we get about 200 requests a week. So we talk to our physicians and try to prioritize those. The state's doing the best they can with the resources they have, and they spread them out evenly amongst the places that can give it. We have about 150 employees out either quarantined or positive. Seemed like a lot, but it's much better than it was a couple weeks ago when we had 300 out. So we're doing better, and that's another indication that the community spread is maybe slowing down. 82% of our employees are fully vaccinated, another 5% partially vaccinated, and about 80% have the flu vaccine. So again, we encourage everybody to get their vaccine and their flu shot. So what's next? We don't know. We're at our peak, and we're hoping we are. The next week or so will let us know that. But I want to close out by saying, please get your COVID-19 vaccine and booster. And lastly, use 911 for the right reasons. Our friends in the local EMS industry would love for you to definitely call when you need to. But for other illnesses that can be taken care of by urgent care center or primary care doctor, please use those resources as well. ERs across the region and across the state have been overran the last couple weeks, so everybody's help is much needed. Thank you, sir.
Thank you, Tracy. Now we'll go to Dr. Wes Stubblefield from the Alabama Department of Public Health.
Thanks, Jeff. Just to build on a little bit of the data that has already been mentioned, we've now had, it's been mentioned, 1.2 million cases of COVID in our state. However, 307,000 of those have come since January 1st. So that should tell you how many cases we've had recently. We currently have around 2,700 people in the hospital across the state, and around 2/3 of those are unvaccinated. We have 19 pregnant women in the hospital, 4 pediatric patients, and we have pediatric patients on the ventilator. This is important because we are currently very low on our availability of both ICU beds and what we call med-surg beds or general beds. We're at 5% on the ICU statewide, 22% on our general inpatient beds. The Southeastern District has only 7% ICU bed capacity. I'm sorry, they're minus 7% ICU bed capacity, meaning that they've got more ICU patients than they have beds. And East Central has 0% capacity. 54 of those, 38% of all patients in the ICU are COVID positive. 54% of those are on a ventilator. In terms of deaths, we have seen most of our deaths between age greater than 75. Most of our cases are in that younger age group, that 24 to 49 age group. In the last 24 hours, we have 69 deaths reported across the state. The CDC has released new isolation and quarantine guidelines and they are rolling those out for different populations, both school systems, early childhood systems, healthcare workers, and the general population, and will soon be into other categories like incarcerated persons. Finally, wanted to mention briefly about the new variant BA2 of Omicron. We currently have little information about it other than it might be marginally more transmissible, but it's not expected to cause more serious disease, and it remains to be seen whether or not vaccine-induced immunity or natural immunity will take care of this new variant. Testing, there has been some limitation, mostly having to do with production capacity, and this is easing as testing demand has dropped. We're seeing that both at the county health department and I would assume across the area as well. We expect this only to improve. The home tests are becoming more available. There have been some reports of a few false negative test results, and those are published in the media, and the FDA is watching for anything that may happen with those tests. They're also it's important to remember that there are a few false positives with these home tests, so if you have a positive test, you have COVID. There are resources for school-based testing across Alabama that's coordinated by the University of Alabama at Birmingham, and I would encourage local school systems to consider that this is surveillance testing. We'll also be releasing some guidelines, what we call test to stay, where students that are exposed to COVID may stay in the classroom if the school implements certain guidelines. In terms of therapeutics, it's already been mentioned, we are on extreme limited basis with our therapeutics. There's only one of the monoclonal antibody treatments that is expected to be effective against the Omicron variant, which is making up upwards of 99% of all cases, and we are on a weekly allocation of that. We do not have control over that allocation. That is a population-based allocation that is provided to all the infusion centers across the state, as already been mentioned. There is a pre-exposure prophylaxis called Evishield that is also making its way into the state, and those that qualify should talk to their physician. This would mostly be people with immune compromise. There is also some information in a recent study about using Remdessavir as an outpatient treatment. This is not coming through the federal government, and this would be something that could also be discussed with a physician. In terms of the Paxlovid, which is the Pfizer oral product, and the Merck oral product, we are receiving every other week shipments, and we're using our federal retail pharmacy partner, Walmart, to distribute those, and we'll be adding more in the future as we get more supply. The FDA does have published guidance on how providers should use these treatments, and so it's important for the public to remember that not because of limited supply, these treatments are being prioritized for certain patients that's already been mentioned. In terms of the vaccine, we have now vaccinated, provided 2.8 million doses across Alabama, at least one dose, and 2.3 million people have completed the vaccine series. Booster doses are available now at a 5-month interval and the mRNA product is preferred. And 2-month interval if you've had the Johnson & Johnson, again, the mRNA product is preferred. These do retain some efficacy against the Omicron variant, especially when it comes to severe disease, hospitalization, and death. In terms of the deaths that have been reported in Alabama, in terms of breakthrough cases, we've had few breakthrough deaths. Most of those have been in people greater than 65, and especially those greater than 75. And 90% of all deaths are among the unvaccinated in our state. I think it's important to mention that the pediatric cases can result in a very serious condition called MIS-C. And we've had between 100 and 200 of these cases. These children are very, very sick, and the vaccine produces a 91% protection against this MIS-C with the Pfizer product. There is still much to be learned about what will happen with long COVID with our vaccines and how this will affect both adults and pediatrics. It's been in a recent study, it was shown that 15%, the people that are fully vaccinated, meaning they've had what would be complete vaccine series without a booster, have a 15 times ability to, or a 15 times greater chance of surviving COVID-19, and for those that have been boosted, it's 68 times chance. In terms of masks, the health departments are not distributing the federally supplied masks. These are going through the federal pharmacy partners that are participating with the federal COVID vaccine response, and people should look to those pharmacies for those mask distributions. Currently, with influenza, we're at a relatively low activity. 5 of our 8 public health districts are above what we call influenza-like activity, which if the baseline in our state is at 3.39%, we're currently at about 3.7%. So we're seeing some marginal flu activity across the state, and we've had no significant outbreaks in the last week. That's all I have.
Thank you, Dr. Stubblefield. Now we'll go to Dr. Sherry Squires from Huntsville Hospital.
Thank you for the opportunity to speak with you today. I am Dr. Sherry Squires. I'm the medical director of Huntsville Hospital's emergency department, and I wanted to share with you a little about what's going on at our department these days. First off, we are an excellent emergency department. I have a fabulous job working there, and I work with amazing staff. That said, we're here to serve our community, and we're a safety net, but we're very challenged at this time. We're still seeing a lot of people with other routine illnesses that have always come to us, accidents, injuries, illnesses, but we're also seeing a lot of COVID patients right now. And a lot of these people are really, really sick. We are short-staffed. We face challenges like most emergency departments in the country right now. We are short-staffed. Over the last year, in 2021, we lost 45 of our nurses to other jobs. You know, there's a lot of opportunity for nurses out there to travel or to take less challenging positions. I mean, our place is a tough place to work these days. We also had 52 nurses that changed from full or part-time to what we call PRN, where they work far less often. So staffing is an issue with us. I mean, and the hospital administration is doing everything they can to try to help us recruit and maintain people. We are very busy, and that also goes for our, techs, our environmental service people. All of those people are crucial members of our team. Everybody that works there is, and they're doing an amazing job. We do urge, as Tracy said, that people not use our department or other emergency departments inappropriately. We are not where you should come to get a COVID test if you have sniffles and sore throat. If you're short of breath, if you're sick, then you do need to come to us, and that's what we want to be there for. We are the resource that you need when you are sick enough that you feel you may need hospitalization, and that's when you want to come to the emergency department or call 911 if you either can't get there by another method or you're that sick. But we don't need to be seeing people with things like, rashes that are not, that have been there a while, or, I've had abdominal pain for 6 months and it's not really changed and nothing acute is going on. Those things are much more appropriately cared for by your primary physician, and those people are usually happy to see you with those things. So we are doing a very good job, but the hospital is very crowded. Our big challenge right now is that the hospital is usually full, and we are holding patients in our emergency department. And that causes our lobby to back up, because if our beds in our emergency department, we have 62 beds. And there was one day last week when we had 50 holds, people waiting to go upstairs. And some of those people are waiting for ICU beds because, as Tracy said, we have, over 40 people with COVID that are in our ICU. This is pretty tough on everybody, and we ask your patience when you come to the hospital, because you will probably, when you come into our emergency department, you're triaged. Depending on how you're doing, if you're unstable, we'll do our best to get you back soon, and you'll be placed in a room and on a bed. If you are stable, you will likely have to wait in our lobby, but we go ahead and we have a team of APPs, nurse practitioners and PAs that have been doing a fabulous job of helping us to screen people that come in that can't be placed on beds immediately. Those people, we initiate your workup while you are out waiting for a bed. So you may get your chest x-ray, your lab work, your EKG done, all of that before you're even placed in the back. And that expedites your workup once you do get placed. But we urge you to come for appropriate reasons, and please be patient with our team, because we're doing the best we can to get the sickest people cared for first. And they are doing a good job at that, but we do ask your help. Thank you.
Thank you, Dr. Squires. And thank you for watching today. Our next scheduled briefing is Wednesday, February 16th at noon. Until then, critical updates will be posted to the City of Huntsville's COVID-19 webpage, as well as the websites of our other partners here today. Until then, stay safe, stay separate, and remember to sanitize. At this point, we'll take questions. As always, as you come to the mic, please identify yourself and who you are affiliated with, and we'll allow one question and a follow-up.
Good afternoon, Dallas Parker with News 19. My questions are for Mr. Doty. Phase 1 of the CMS vaccine mandate deadline is February 14th, I believe. Correct me if I'm wrong. How much of an impact do you anticipate that deadline will have on your staffing? Do you still see people who are kind of reluctant to get the vaccine in the healthcare field right now?
We actually looked at those numbers this morning. We're doing very well. About 8,000 employees in Madison County. We have about 150 or 60 who haven't gotten the vaccine that we know of, are giving us the declination. So managers are talking to those staff members. We're predicting probably half got the vaccine other places that we don't know about, and the remainder will probably do a declination. So we don't see a huge impact. We've been talking about the vaccine with our staff for a long time, and everybody's doing a great job.
Thank you. And you mentioned you were hopeful we're at the peak of all of this, and you kind of mentioned a few examples. Can you give us like a clear list of indicators that may be the case?
Yes, so the positivity rate being dropping to the 37%, peak was 45%. We like it to be back about 5%, though, like it was December of last year. The fever and flu clinic is an indicator, so they're not as busy as they once were. Our employee vaccine area, our employee testing area, the numbers have dropped there. We're seeing about 75 or 100 a day. Yesterday was 35, so it lets us know this is one indicator. And the ambulance services, EMS, they're still very busy seeing COVID patients, and their numbers haven't dropped yet, though, as far as their encounters with COVID patients. John Howell mentioned that on the call this morning. So 3 of the 4 indicators that we look at are pleasing to us. So we'll look over the next week or so to see if that trend continues.
Thank you.
Alex Lynch, Way 31. Got to pronounce this correctly. Sotrovimab, effective against Omicron, and how is the supply?
We talked about earlier. The federal government allocates it to the state based on population, and it's spread evenly the best the state can. We're getting about 12 doses a week for that monoclonal therapy. And then if you look at the amount of people who need is about 200 a week that we're seeing, but we triage the most critically ill patients to get that.
Nixon Norman with Fox 54. I have a question for you. You had mentioned that a lot of nurses are leaving the industry. Are any of them expressing why? I know some are probably obvious reasons, but can you tell us some of those reasons why?
I'm sorry. Some of it is leaving the industry because healthcare is just tough now. You know, I mean, they look at their friends who have jobs working from home, and that's pretty desirable for a lot of people, you know, so there are other opportunities out there. Some of it is that they have travel opportunities. I mean, there are places all over the country that are just paying really high rates, and we're not the only hospital challenged by that. I mean, it's hard to compete when you can go out and make 3 times your normal salary and pay off your student loans and buy a house with that. And they're taking advantage of that, especially if they're young, single, no kids. That's an opportunity that they just can't pass up. So other things, I mean, there are a lot of less difficult jobs than emergency medicine. I mean, if you're in emergency medicine, it's because you love it. It is challenging, and it's a lot of fun. It's a great career, but it is exhausting right now. I mean, we joke that when we leave the ED, we feel like we've been beaten up some days because it just really is a tough job these days. You know, COVID has just a bunch of challenges.
And then my follow-up question is, you had mentioned, you know, go to the emergency room if you're really having shortness of breath, or I can't remember the other thing that you had mentioned. But in that case, say somebody is having shortness of breath, they're like, I shouldn't go to the hospital. What do you advise people? What are those real indicators that they should go to the hospital?
Well, if you are short of breath, especially even at rest, you know, or with minimal exertion, you need to come to the emergency department, not just because of COVID, because that could be something else too, heart disease, lung disease. But if you have a diagnosis of COVID, it's a good idea to invest in a little pulse oximeter that I think at the drugstore is like $20. And if you feel short of breath and you measure your oxygen level and it is in the 80s or it is below 90, then you need to come and see us, because those are indications that you may need, you know, the kind of treatments that we have to offer. Other people that are coming in with severe illnesses, or some of these people have really bad nausea, vomiting, and diarrhea and are getting very dehydrated. And that's dangerous, when you can't keep down your medications or you're very lightheaded, dizzy because of that. We need to see you at those points. The ones we don't need to see are people with few risk factors, younger people especially, that just have a little bit of sinus congestion or just want to be tested because of known exposure. The emergency department is not the appropriate place for them.
Thank you.
At this point, we'll end the press conference. Thank you for coming.
And you have been listening there to local hospital and county leaders here in Madison County talking about how we are progressing in the fight against the Omicron variant and, of course, the pandemic as a whole. One of the most staggering things I heard there, really surprising, we hear the numbers are coming down as far as new infections, but across Alabama in the past 24 hours, 64 COVID deaths. We keep hearing Omicron is not as severe as perhaps the earlier strains of the virus, but then we're hearing that many deaths in 24 hours. A bit of a wake-up call that this is a very serious thing we're talking about. Still not out of the woods, and vaccinations are by far, they say, the best way to fight this.
Yeah, Chris, there was a lot to unpack there, like you had said. The monoclonal antibody treatment that does work against the Omicron variant, they have such a limited supply of that. Huntsville Hospital alone only get, I believe they said, 12 doses from the state a week. There's 200 people on average that need that monoclonal antibody treatment, and that is prioritized for cancer patients, organ patients, and pregnant patients. So that is not your best approach if you need to, fight this virus. That's why we're always asking you to get vaccinated. Another thing, if you have our Way 31 News app, then you would know that Madison County surpassed all of 2022 cases. And lastly, we had heard that the ER department is just reaching it. They don't know what to do anymore. So they ask you, if you're showing symptoms, if you were exposed, if you need testing, do not go to the ER. It sounds like their staff is really struggling there and having some shortage issues. And I'm going to break it all down at 4, 5, and 6 on Way 31 Evening News.
For now, we want to return you to regular programming. We hope you have a wonderful afternoon.